Another grim day for the province's COVID-19 crisis. Saskatchewan's Emergency Operations Centre confirmed earlier today that it is in conversations with the Ontario government about shifting patients to that province. Saskatchewan's ICU capacity is 135 beds. The number of patients fluctuates throughout the day, but they're getting closer to making a tough decision. Health officials say just one serious incident could force them to send patients out of province or triage who gets care and who doesn't.
We've built out capacity today to have 135 ICU beds in operation in the province of Saskatchewan. We haven't reached that threshold of 135. At that level, we won't believe we're providing a standard of ICU care, so we have set the target lower for out-of-province transfer.
The news comes as healthcare workers such as occupational therapists have been pulled away from their jobs to conduct contact tracing. That's left some medically fragile children without access to treatment or therapies that have been deemed non-essential. The opposition says the province's decision-making is baffling.
The idea that pulling physiotherapists, occupational therapists, and other health professionals away from their essential work with helping kids, with kids they've established relationships with families that they've established relationships with, is better than simply picking up the phone and asking for help, is madness.
The province also confirmed that despite the dire situation described by officials, it has yet to formally request assistance from the federal government. That decision was also harshly criticized by the opposition.
It's baffling. I don't understand why. And there was no explanation given why this government has chosen, when there is help available, to not take that help.
Throughout Wednesday's COVID-19 update, officials were repeatedly pressed about why they had yet to make a request for federal assistance, such as access to more critical care nurses. Saskatchewan says it's canvassing around to see what resources are available, but didn't provide an answer about why it hasn't made a formal request. This is despite the federal government saying it's ready to provide healthcare workers, equipment, and anything else that is necessary. Alexander Kwan, CBC News, Regina.